Hello friends, welcome all of you in the last 10th class today. Yes, we will recite the prayers first. वह शक्ति हमें दो दया निधे कर्तव्य मार्ग पर डट जावे पर सेवा पर उपकार में हम निज जीवन सफल बना जावे निबलो विकलो की सेवक बन संताप जो है बिछुड़े भूले भटके उनको तारे खुद तर जा चल खंड झूठ अन्याय से निशिदिन दूर रहे जीवन हो शुद्ध सरल अपना शुचि प्रेम सुधारस बरसाए निज आत्मान मर्यादा का प्रभु ध्यान रहे अभिमान जिस देव भूमि में जन्म लिया बलिदान उसी पर हो जाए वह शक्ति दो दयान कर्तव्य मार्ग पर डट जाए वह शक्ति दो दयान कर्तव्य मार्ग पर डट जाए. Okay, we offer our respectful gratitude to Kinka sir and Milind sir, Singh sir, and all members, all team of the Sansthan who arranged these lectures. Okay, we will begin our last class today of 3 times 4 Electro Acupuncture by Dr. Voll. So yesterday we have completed almost up to gallbladder meridian. Today we will begin with kidney meridian, chapter number 13, page number 179. Okay. Yes. So kidney meridian. See, now you have to remember, you might have learned in the previous semesters, kidney meridian and urinary bladder meridian. So these are very much related to genital systems, urogenital. So that's why it is called as urogenital system. So kidney is, there is the essence of life, the kidney stored, the energy which is coming from the heredity, from mother and father and their ancestors, ancestral energy. So kidney and urinary bladder, these meridians are related to brain also, because in the kidney there is cortex and medulla, as we can see the structure of the kidney, and same structure is there in the brain also, cortex and medulla, gray matter, white matter. So it is nothing but the essence. That's why it is related to brain also. Okay, we can see this location in EAV. Kidney meridian starts from the root of nail on inner side of 5th toe of foot, whereas in Chinese acupuncture, kidney meridian starts from the K1, from the sole of the foot. After that, location of points from K1 to K6 is different in EAV and Chinese acupuncture. After K6, the location of all other points is similar as that of Chinese acupuncture. Okay, K1 to K6 are little different locations on the little toe, inner side. Now, number of points, there are 38 points according to EAV, but originally there are 27 number of points. So 11 points are additional here. New points. Now we can see the specifications that CMP of kidney and ureter is K1-3. Okay, K1-3. Another you can read it out. Now 11 points are redefined, which are the In that you can see this K5 is for anal canal and K6 is for rectum. So along with the urogenital system, also rectum, anal canal, that part is also controlled by the kidney. The sphincters, especially sphincters of anal canal. Then Chinese K1 is a deep lymph of kidney. For every serious disease of kidney, give treatment on Chinese K1. Yes, I know. In my practice not recently, but before 4 years, 4 years back, I got my patient. He is my neighbor only. So she is almost 75 years old lady, and we said her here Ajibai. So that Ajibai's relative has come and told ki, I think, doctor, can you come to a place to visit? Our Ajibai has left the body, I think, because her movements are almost no movement, null movements are there, and she is not responding to any stimuli like that. So I just visited the place, and in the evening, I think it was at 9 or 9:15 in the evening. So somehow I could see Ajibai, and I checked her all the responses to the food, all the pulses. Pulses were very small pulses I could feel, and other responses were very null, means no responses to any stimuli. So, and they were directly, they themselves are convinced that our Rajibai has left the body. So they took a tulsi patra and in a water pot, and they just have given some water in her mouth. So 2-3 spoon water has gone inside the mouth, but after again 1 spoon, it is coming out of the mouth. And so I heard also yes, this is, I think she left. But somehow or other, I could do one thing to her. So I know this point, K1. K1 is the strongest single point in the whole body. Even after GV26 here, K1 is strongest in. And it is main is earthly energy. This GV20 is getting the energies from the heaven, and K1 is the innermost point. YIN, innermost point of our body. So it gives the in energy, receives the in energy from the earth for the human beings, for any living entity. So I suddenly ran back to my clinic, and I got one steel Jimmy, and I somehow stimulated very vigorously to her K1 point, both sides. So she suddenly started crying, like, ah! Her stimulus were like that. And all people were looking to me, doctor, why you are giving trouble to her? What happened? So I somehow convinced them, this is not, this is the part of the treatment. This is not to give the trouble to the dead body. She is not dead. She's alive. And now you can go fast to the nearby hospital and just get her admitted. So after that, now she is 80. It is 79. After 4 years, she is okay. And she is going here and there. So this K1 is very miraculous. K1 point. This was my personal experience, and I have used from that day, within this last 4 years, I have used that K1 to so many cases. Wherever I feel ki, some stimulus is not there, some patient is having fainting attacks or somewhere, I just use K1. Patient gets energy fast. It's very fast, but we have to stimulate very strongly with very powerful move. This K1 is there. Then these are the plexuses, different plexuses, renal, rectal, all plexuses. Then first treat these three plexuses in chronic diseases of kidney which corrects disorders of steering. Then K1-1 is the point of lymph vessel. Then there is one control measurement point, that is K1-3, that is CMP for kidney and ureter. It is the best point for the treatment of kidney and ureter. Okay, now we will see the point wise in the diagram, location and function. You can see in the diagram at page number 183 the locations of the point, the inner side of the little toe. K1, then K1-1, 1-2, 1-3, then K1-4, yes, K1A and K1B. Okay, K1 is renal pelvis. It is called pelvis of kidney. So you might know that pelvis is the part of a kidney structure, its function. In BHB, you might have learned this. Renal pelvis, it's below the part where all the urine is accumulated and ready to come down to the ureter. The renal pelvis. So different parts have different parts and different points have given there. Then K1-1 lymph vessel of the kidney and adrenal gland. K1-2 renal plexus. The plexuses. It gives the stimuli with these different parts, the innervation, nerves stimuli. Then K1-3 CMP kidney and ureter upper portion. Then K1-4 peritoneum of the kidney. K1A ureter, abdominal portion of the ureter, from the kidney up to the bladder, it's abdominal portion. Then K1B suprarenal plexuses, adrenal gland. Above the kidney, there is a small gland, that is suprarenal gland or adrenal gland. Their plexus is there. K1B is the point for that. It increases the secretion of adrenal gland. K2, pilorenal region of the kidney, comprising of renal medulla. It's the main part. Renal medulla, the rounded spices of the renal pyramids. Then papillas with collecting tubes where the urine or the absorption of the water collects. The main and accessory renal calyces. Special note: a deficiency here indicates a stone. Yes. If there is deficiency on K2, it is a stone, renal stones. Now K2A is a renal medulla. For the straight canaliculi and collecting tubules, it treats acute inflammation affecting kidneys. The inflammatory disease of the kidney can be treated with this K2A. It is given an axis on the side of the K2A indicates focus of distance foci on the last point. A deficiency on this point indicates degenerative process or a nephrocirrhosis. In this case, tone this point. Yes, you can tone this point K2A for degenerative process of nephrocirrhosis or nephrosis. K3 renal parenchyma, renal cortex. Main parenchyma of the kidney. Damaging glomeruli or tubuli contorti results in protein albumin in urine. Treat K3. Yes. If there is in urine reports somewhere it is mentioned albumin or protein is plus in the urine. So if it is presence in the urine, so that means there is a glomerular or tubular diseases, damage to the renal parenchyma. So you can treat with the help of K3 because this is a source point also. We know by according to TCM also, the source point of it. Now come to the page number 187. Next page. K4 medial and inferior lower rectal plexuses. These are plexuses again. Treat hyper emotions here. Hyper emotions. This is sympathetic nerve supply and innervates lower rectum and middle rectum. Treatment on this point closes sphincters and stops motions. So if somebody is getting loose motions, you can use this K4. It stops, contracts the, closes the sphincter, anal sphincters, and stops the motions. Then K4A, it's anal sphincter again. When anus shrinks and there is a difficulty in passing stool, treat this point. So in such cases, we have to tone this. It's the contraction, no? So difficulty in passing stool. So it's we should have to tone this point. When anus dilates and retaining capacity of stool decreases, tone this point. Correct. K5, anal canal, with hemorrhoids, inflammatory lesion of anal canal, fissures, and eczema. K5. K5 is rectal venous plexus. K6 is rectum. Come to the page number 188. So rectum, anus, hemorrhoids, then inflammatory irritation of the anal canal, fissure in rectum, eczema in rectum, or anus. K6, K5 and K6 is special points for which are taking care of anal canal and rectum. K6A, lymph drainage of rectum and anal canal. K7, it's very important point again. K7, it's important for blood. It is an important point for the problems of blood. Treat K7 and SP6 along with this. And also we have to treat urinary bladder 17, which is influential point for the blood. Any blood disorders of blood. To increase the blood, hemoglobin, RBCs, WBCs, platelets, etc. Liver 5 and PN6 is in the case of the problem of chemistry of blood. Different chemical compositions of the blood are less or increased. So we have to treat liver 5 and PN6 also, along with this case data. K8 is a thin crossing point, then K10A is the adrenal medulla. Now these are the diagrams. Directly come to the page number 192. So K10, suprarenal cortex. K19, renal rami of vagus nerve. Then K20 is celiac rami of vagus nerves. A treatment on this point, K20, increases secretion of pancreatic juice and hormone insulin. You have to note this. Rate of digestion and absorption of food is increased. So it increases the appetite also. Inhibits conversion of glycogen to glucose. It inhibits the conversion from glycogen to glucose. Otherwise, it increases the blood sugar level. So in diabetic patients, we have to use this K20 because it is ultimately increasing the secretion of pancreatic juices and insulin also. And the last K21, hepatic rami of the vagus. This much points are given here, and other points are there actually from K22. You can see in the diagram 191 page. K22, 23, 24, 25, 26, 27. These are actually on the chest area, just lateral aspect of sternum, this sternal borders on both sides. Okay, so this is regarding kidney meridian. We can read this also on page number 193. Some important information. K27, a secondary vessel goes to UB1 on this meridian. There is a point for sternoclavicular articulation for this joint on the upside. Sternoclavicular, the medial end of the K27 of the clavicle. Okay, each kidney contains about 1 million nephrons, 70 millions of tubules. 99% of water is absorbed by the nephrons. Only 1% of water remains as urine. Treat right kidney nephrons at K3, right, and or K1-2, right, for damage of the right kidney. And there are some reasons how the right kidney gets affected. Methyl formaldehyde, then which are used in the laundry products. Then fluorides, which are used in a toothpaste. Fluoride, salicylic named chemical harms kidneys. Then monosodium glutamate. These are the chemicals used in preservatives sometimes. Sodium glutamate, carbon black. These are the chemicals which affects the right kidney, and even left kidney is given there. The left kidney rate known said we have to treat this on K3 left side and K1-2 left side. Renal vexes for damage in the left kidney due to chemical named chloride chlorides damages the left kidney. Benzoates, sodium benzoate. These are the preservative. In each and every product outside in the market, we get which are the ready to eat material. They are being this chemical sodium benzoate is used as a preservative in all these substances. The iodine, too much iodine consumption, which is contained in the salt, that is also left kidney damages because of that. See here, preservative chemicals used in packaged foods, pickles, chutneys, tomatoes, sauce, etc. They are more harmful for the kidneys because to filter out those chemicals from the kidney region, once we have ate this, filter out these chemicals have effect on the renal parenchyma, main structure of the urine, and the tubules, the nephrons. So it is stated above that K1 of Chinese Acupuncture is a deep clean for kidney. Treat this point for the problems of kidney. Yes. First kind is the 13th chapter, kidney meridian. 14th chapter, urinary bladder meridian. Come to the page number 194. Now remember, urinary bladder meridian, it starts from the inner side of the inner canthus of the eye. It goes upside. So it's up to the point urinary bladder 10. These 10 points are on the scalp. So it is also related to brain disorders. Again, its course is on the back side, and then up to the pelvis, then thigh, and on the back side of the leg, up to the foot and little toe lateral aspect. This is according to TCM. Now, both courses are same. Starts from the inner angle of the eye and goes to the root of the nail on the lateral side of the little toe in foot. Number of points, there are 88 points. Already it has 67 points according to TCM. 21 points are newly defined. See in specification, urinary bladder 66B is the CMP of urinary bladder or urogenital organs. It is too much related to urogenital organs. Why? Because at the pelvis side, when lumbar is finished on the back side, so its course is like in a zigzag manner. It reaches to the pelvis up to the coccyx, then it goes on the lateral aspect. Again, it comes down. It's like too much area is being covered on the back side of the pelvis, the lower back. So it is very much related to urogenital system. Now in specification, you can see this urinary bladder 50B. It's the special point for Cowper's gland and Bartholin's gland. So you might heard this term in BHB. It is a urogenital system related, genital system related glands actually. This Cowper's gland is present in male, in the just below the prostate. It secretes some fluid to lubricate the passage of the urethra. It is especially at the time of the sexual activity. And Bartholin's gland is in the female, at the base of the vagina, at the entry side of the vagina. It is also for the secretion of some liquid to lubricate the vagina. These are two glands, very important glands. Then these are also can be treatable by this point. Then come to page number 195. CMP of brainstem, urinary bladder 2A. It is here 2A. So it is also used for brainstem. Okay. Another are for genital system. Another points are for this brain system, nervous system. Possible to easily treat infection of urine and genital organs, venereal diseases, and dangerous diseases, serious diseases. Okay, all the points. Then points discovered related to various parts of genital organs made easy to treat: prostate, fallopian tube, etc. Urinary bladder, meridians passes from the head. UB2A CMP for the brain stem, UB21 olfactory nerves 2 and UB10A-1 accessory nerve 12 are on this meridian. Okay. So 28 points which are redefined are here. The body of urinary bladder 67, then 66, bladder, trigon of sphincter. You can read it out. We will see that later also. UB54, come to the page number 196. UB54 is the back side of the knee joint, posterior knee joint. Okay. Anterior portion of urethra, penis and vagina, lateral prostate. This is upside of the knee. 54, then 53, 52, 51, 50. It is on the thigh back side. Then UB30, you can see sphincter muscle of urinary bladder and rectum. Then you can see UB22, it's the back shoe point of the adrenal gland. Yeah, all the back shoe points of all the meridians are located on this urinary bladder meridian. Okay, UB22. Again, UB12 is SMP for bone systems. Yeah, UB11 is influential point according to TCM. Influential point for bones or bone disorders. And this UB12 is for all bone disorders. And UB11 is SMP full spinal vertebrae. All spinal vertebrae can be treated by UB11. Then pineal gland, you can see UB8. UB8 is for pineal gland. It is here somewhere. It is related to, it's very near to pineal gland. Then these are the following plexuses: posterior plexus, urovaginal, cavernous plexus, vesical plexus, rectal plexus. Control measurement 266B and 2A. Then summation measurement points are 4, 65, 64, 12 and 11. Then peritoneal measurement UB66A, lymphatic drainage 66D. Okay. Now for diagnosis, excess of energy on UB66 and UB67, left and right, indicates an acute cystitis. Come to the page number 198. Yeah, they have mentioned some voltage drop, indicator drop, according to that machine thermometer. So it is for diagnosis purpose. Autonomic balancing is mentioned here. UB32, 4, 35, 33, different parts. Autonomic balancing. Okay, come to the page number 199. Urinary bladder meridian. We will see its functions. UB67, body of urinary bladder, structure of urinary bladder. Then UB66D, lymphatic drainage of the urinary bladder. Any lymphatic drainage point, whenever there is infection, we have to use lymphatic drainage point, and it should be sedated always because of infection. Then UB66C, vesical plexus, all plexuses. UB66B, CMP for urinary bladder, and CMP for urogenital organ. UB66A, peritoneum or serous coating. Come to the next page, 201. It has mentioned in women and in men. What is the difference? Then UB66, sphincter of the urinary bladder, 66. You can see in the diagram on page number 200. Where is the location of the point? Then UB65 is for PSMP for genital organs. So we can treat all the genitals here. Okay. In male and in female, which are the different parts are covered with This point. Come to the page number 203. Here Bartholin's gland is mentioned. See, a pair of Bartholin's gland is located on either side of vagina, just before its opening into its vestibula, covered by lips of labia minora. These glands are peach-shaped and size as a duct which opens into the vestibule. These are the tubulo-alveolar gland, which secrete mucus, especially at time of sexual act, so to behave as a lubricant. Also treat TW1 with this point in all other cases. Okay, UB64 is a PSMP, appendages of the genital organs. Appendages means what? This in males epididymis or diaphragm canal, and in females ampulla of the uterine tube, fallopian tube. Okay. Then UB63, the lower hypogastric plexus. But treatment on this point inhibits micturition and defecation by closing the sphincter by increasing its muscle tone. We already seen that. UB63. What is UB63? UB63 is Zicklep point in the, according to TCM. UB63 is Zicklep point. Yeah, Zicklep point of beginning. Then UB62 is posterior talocalcaneal joint. It's on the joint. 62. Below lateral malleolus. Exactly below lateral malleolus. There is the location of this point. UB60. Now UB61. This is specific point for this lumbar and sacral bone, lumbar spine, sacral spine, and coccyx. This is also called as autonomic steering point for the lower limbs, for the lower limb nerves. If any lower extremities vessels, blood vessels. 61, very important. Then UB60A, lymph nodes of sacrum. We have to select the lymph node. UB60, nerves of the lower extremity. We have to tone this one. If some disturbance in the movements of the lower extremity or functions. UB60. It's on the lateral aspect, backside. In between the tendocalcaneum, tendo achilis, backside. Tendo achilis and the lateral malleolus. In between that, this point is the located. UB60. Then UB64 is posterior knee joint. We have seen this. To treat the knee joint, we have seen lever 8, GB33, ST35, and backside UB54. Okay. UB52, anterior portion of urethra. Then UB51A, posterior portion of urethra. Come to the next page. You can see the diagram here on page number 205. Come to 206. UB51, it is for penis and vagina. Any complaint regarding penis and vagina, whether it is burning, anything. So UB51 point is located on the back side of the thigh. It's almost called as the line from the buttock line up to the center of the knee. It's the center of knee and the line drawn from the center of knee up to the buttock line. That is on that line, the center of that line is a UB51. Okay, now UB50C, cavernous sinus plexus, or the penis and clitoris. Then it innervates the penis, clitoris, and urethra. UB50C. The UB50B is Cowper's gland. We will see Bartholin's and Cowper's gland. UB50 is seminal hillock. Then UB50-2, prostatic sinus. Partial vaginalis, vaginal part of the uterus. Then UB50-1, middle lobe of prostate. UB50 is lateral lobe of prostate. UB49D, differential or seminal prostatic plexus of the nerve. Then UB49B, so spermatic cord and vas deferens. You have to know this, all the structures in the body. Spermatic cord and vas deferens. Somebody is getting pain for this. The inflammation of spermatic cord was referenced there. So too much pain in the testicle region. So this UB49B, 49C is the very important ones. UB49A, come to page number 208. Epididymis of ostium, fallopian tubes openings. Okay, UB35, preganglionic branches of the sacral portion of the parasympathetic nerves. UB34, pelvic plexus of parasympathetic nerve. See this UB34, you can see its location here. 34. Yeah, on page number 211, its location is given. 34. This is the cleft of the buttocks. Near to that is 35, then 34. It's on the sacrum, the inner side. 33, 32, 31 on both sides. So this point is very important. 32, 34. You can see 34 is for descending colon, sigmoid colon, rectum, and urinary bladder. Because of its location, this is taking care of large intestine also, descending colon, sigmoid colon, rectum, and urinary bladder also. Because its innervation is going from this pelvic plexus of parasympathetic nerve, UB34. These are very important points. I am using this as acupuncturist, but we can use the magnets also for some problems. UB33, SMP, pelvic portion of the sympathetic nerve. UB32, pelvic splanchnic nerves. It innervates the pelvic and genital organs. UB32. UB30, sphincter muscle of the urinary bladder and the rectum. UB29, thoracic vertebrae. UB28, associated point of the back. Yeah, now you have to know all the back points which are present on the urinary bladder. It is starting from almost 13. Urinary bladder 13 is for. Now you can, yeah, Pushpa VG. What is the difficulty? Anything you want to ask? You have raised the hand here. Yes, anybody? And it's not audible. Just who want to speak? Okay, it's not possible for you to unmute. Okay, it is muted for participants. Okay, let me know. Let me know. Yeah, Piyush sir. Hello, Piyush sir. Can you?
Sir, can you revise this assignment objective questions at the end of the class, sir?
Yeah, okay. Where is that? Okay, okay. I will check. I have a book. We'll see that. No problem.
Yeah, thank you, sir.
Okay, we will go ahead. So these now you just let me know all the back shoe points. What is UB13? Anyone from you? UB13 is back shoe of correct. UB14 no. UB14 is for not LI. 14 1 4 correct. BC 15 correct. 16 17 18 correct. 19 very good. 20 20 is for again it is divided into right yes right side PN and left side SP. 21 21 is for stomach yes. 22 yes very good. 23 very good. 24 25 yes and 28 is for urinary bladder itself correct. So we have to know these points and the second line of urinary bladder the channel is starting from you can see it's a diagram is given here on page number 209 from 12 point UB12 to UB25 almost on second page UB30. So along with that 1.5 kun lateral to the first line of urinary bladder channel there is a second line. The point starting from UB36 which is a parallel and the on the same level of UB12. Then UB13 at the same level UB37 is there. UB14 same level UB38 is there. 15 39 is there. So whatever work is done by this 12 13 14 15 16 17 up to 28 the same work which lymph node drainage is being divided by Dr. Kenkasar means Dr. according to Dr. Voll the same functions of those particular organs means suppose UB13 is the back shoe point of lung. So the lungs lymph drainage point will be UB37. So that is the function of the parallel points. So ultimately, if you know all the back shoe points on the back, so on this urinary bladder channel, the second channel from 36 to almost up to 49, you will know the functions. These are very easy to remember. We can see one by one here. Now UB28 is associated point or back shoe point of the urinary bladder. UB27 is sacral joint, back shoe point of small intestine. 27, 25 is back shoe point for large intestine. UB24 is this in the abdominal portion of the sympathetic nerve. UB23 is back shoe point of kidney. UB22 is back shoe point of triple O organ. Here they have mentioned MP for the adrenal gland also because it's related to triple O organ. This area wise. CV5 is the alarm or the front shoe point of the TW. CV5 is the MP for the suprarenal gland again. CM front shoe point. And TW1 is SMP for adrenal glands and gonads. Okay, 21. UB21 back shoe point for the stomach. And at the same time, they have mentioned the front shoe point also, front move point. Alarm point of the stomach is CV12. Come to the page number 212. UB20, back shoe point of the spleen in left side, back shoe point of the pancreas on the right side. UB19, back shoe point of the gallbladder, UB18 is back shoe point of the liver, UB17 is MP for diaphragm, or it's the influential point for the blood. Diaphragmatic hernia can be treated here. UB17 on left side. Then UB16, thoracic portion of the sympathetic nerve. UB15 is back shoe point of the heart. CV14 is its move front point, alarm point. Then all the move front point are almost on the CV channel. And back shoe on the urinary bladder. Urinary bladder 14, pericardium and circulation. We have seen pericardium meridian is a circulation meridian here. UB13 is back shoe for lungs. UB12 is the SMP for the bone system of the whole body. Okay. Then in the special note they have mentioned treat UB12 along with pituitary gland, parathyroid gland, etc. for the deformity of bone or growth hormone, thyroxine, thyrocalcitonin, parathormone, and testosterone. Treat bone TB on this point. So this urinary bladder 12 is very important for growth also. Then UB11 SMP vertebra of full spine, MP for the thoracic spine, UB29 along with this. UB10C inferior lower cervical, all the ganglions. Then UB10B medial and middle cervical ganglion. UB10A-1 accessory nerve 12. UB10A next page 250. Here they have mentioned C. Treat the thyroid steering at urinary bladder 10A. So you can look in the diagram 214 page number, urinary bladder 10A number point. This is just the base of the brain. So here it is mentioned treat the thyroid steering at urinary bladder 10A, B, and C plus ST12 or MP carotid sac. So any thyroid dysfunction, you have to treat 10A, B, and C also. Urinary bladder. Now 10 urinary bladder 10 bulb of medulla. This brain stem. The respiratory motor vasomotor are situated in this, which controls this. We have seen this in BHB. You might have learned this. What is the functions of the medulla oblongata, which controls these centers: rate and force of the heart rate, cardiac center, respiratory center, vasomotor center, reflex centers. All are there situated in medulla oblongata. Waiting, coughing, sneezing, swallowing, everything. UB9. MP pons. Then urinary bladder 8, it's the MP for pineal gland again. And urinary bladder 2A, it is here. You can see in the diagram 217 page. UB 2A, 2A, 2A-1 and 2. These 3 points. CMP for brainstem, then olfactory nerve. Also treat ND3 and all that points. UB2 is a frontal sinus, and CV3 is they just mentioned alarm point of the urinary bladder. Is located below umbilicus, just above the pubic symphysis. CV3. Now they have mentioned on page number 218 some special points regarding that I have already told you. UB36 is limb of bone whole system. Then UB37 is limb of lungs. UB38 limb of pericardium. UB39 is limb of heart. It's a corresponding points which are on the same level but it's parallel in the second line of the urinary bladder meridian channel. The same thing, the same functions, but it's a lymph node. It's mentioned in the last paragraph. Secondary meridian goes to UB1. Secondary branch of lymph vessel starts from the UB36 and goes till UB49. On this branch, there are lymph drainage points to various organs, which is discussed in above table. Yes. Okay. So any infection or ulcer, wounds, bursitis, fibrosis in this particular organs, we can treat this. Okay, we will go to the next chapter number 15, conception vessel, CV meridian. You all know this conception vessel meridian. Now all the alarm points of all the meridians are located on this conception vessel meridian, CV, or front move point, the front shoe point. In EAV and Chinese acupuncture, both the location of conception vessel is same. This meridian starts from the perineum between rectum and testicles and further goes below abdomen and frontal part of the body to cavity between the lower lip and the tip of the chin. This is the tip of the chin and the lower lip. This ends the conception vessel meridian here. It's a CV24 here, 23, 22. It's a very specific point for, I am using this point for constipation because this is the last point of this meridian and it starts from the rectum, just near to rectum, anal canal. So constipation can be relieved by pressing this point also. In the morning while going to the defecation, pass the stool. If stool is not coming out, you can just have a rehearsal. Just press this point firmly with the thumb or with the index finger. The stool will start coming out. It's very effective point. Acupressure is also very effective on this point. So number of points are 27 and according to Chinese 24. So new 3 points are there. You can see the specification. These 3 new points are used for tongue, sublingual gland, and pharyngeal tonsil. These are located here on this side below. This is 24. This is 23 is here. 24 is here. In between that, this all the points are located. 23 A, B, and C. Then your following points are the conception vessel are redefined, which increases their usefulness. CV24 SMP4 middle or lower jaw, larynx, trachea, bronchi, etc. Okay, we'll see this points. See the diagram, 221 page number. All from CV1 to CV24 or CV. Okay, come to the page number 222. CV3 salam point or movement point for the urinary bladder meridian. Okay. Now you can note here, Khenpasar has written here this in every point of conception vessel that can be useful for the amputees, where suppose some patients are there which do not have both the hand and both the lower limbs. So in those cases, so it is specially meant for leg amputees used arm where there is amputation. There are some patients. Few patients are there who do not have both the upper limbs or both the lower limbs or all the limbs. So we can use this points in such cases. CV3 is alarm point for the urinary bladder. Use it for the amputees. Also treat urinary bladder 28 point back to point of the urinary bladder. So it is mentioned in which is the back to point also with the front point. Movement. CV4 alarm point movement point of the small intestine. CV4 for small intestine. And UV27 is the back shoe. CV5 is the alarm point or movement point of the hormonal imbalance. It is because of the endocrine system, the triple hormone point. Front shoe point of triple hormone. CV5 and back shoe is 22, UV22. So any hormonal imbalances, endocrine system related point. We can use if any hormonal imbalance is there in ladies patient, especially females, we can use TW1, triple one or 1, 2, 3 along with this one, CV5 and urinary bladder 22. Very important point. Almost all hormonal disorders are covered. All of these points. Even triple gallbladder 21. CV12, alarm point or movement point of the stomach. Also use UB21. This is a backshoot point of stomach. Then come to the next point. CV14 is the point of the heart, and backshoot is urinary bladder 15. CV17 is symmetrically MP for bronchi. CV17, it is situated in between both the nipples on the sternum, exactly the center line. It is MP for bronchi or MP for lung. When lungs is a sea of energy for lungs energy speech. Then CV19 asymmetrical MP for trachea. Then CV21 MP for larynx. Yeah, it is used for aphasia in patients of aphasia where voice is not clear, voice is not coming, aphasia. So in that cases we can use K1 also, K1, then heart 5, H5 and H7 also. H5, 6, 7 almost all. H5 is very important in aphasia cases. And along with that CV21 for aphasia, because it's the MP for larynx. Larynx produces the voice. Then CV23A, asymmetrical MP for the tongue. Then CV23B, MP for sublingual glands. 23A, B, and C. We can see its diagram. Yeah, on page number 224. No, on page number 225. 23A, 23B, and 23C. These are here only 1, 2, and 3. And then comes 20. Above this hyoid bone is a 23. Then 23A, B, and C, and then 24. 23C is pharyngeal tonsil. Okay, these are some diagrams. And special note: even after operation of pharyngeal tonsil, there can be leftover adenoid residues as scar residues. This residue scar can continue to trouble and may cause hearing disturbances. It can cause hearing disturbances. Treat such hearing problems here, that is CV23 and LI18-2. LI18-2 is here, and CV23. Put the points can be treated in such cases after operation of pharyngeal tonsils. Then this is CV24. It is the exactly center of lower lip and the tip of the chin. SMP of middle of the lower jaw, middle mandible, in the central bottom of the lower jaw. Yes, lower jaw, all the 1, 2, 3, 4, 1, 2, 3, 4 on both the sides. 8 teeth can be treated with the help of this point. CV24. This something is mentioned here for the amputees. All the points. The alarm point, movement point is the more important. It can be measured on the electronic machine, the dermatome. Associated points or backshoot points can be measured on the electronic machine. For amputees, the alarm points or the movement points on vertical side of the body may be used. For example, use GB25 for treatment of kidney of the amputees. Okay, GB25 for the kidney. Use ST25 for the treatment of large intestine, and use liver 13 for the treatment of spleen or pancreas of them. Yeah, we know this. Liver 13 is located just below the 2 pun below nipple in the 6 intercourse space in the anterior nipple line. So this ends our 15th chapter, conception vessel. Now almost the last chapter of our syllabus today, the governing vessel, 16th chapter. Now you just see governing vessel is also starts from the backside of the anus and goes upward according to TCM, the main meridian I am telling about, and it covers the full area from the spine, the center of the spine, and comes to the base of the brain, then center of the skull, and comes onto the glabella from here on the center of the nose, tip of the nose, then the center of the lip, upper lip, and inside it ends. That is GV 28 number 27. So you can see its location in both EAV and Chinese acupuncture. Location of governing vessel is same. This meridian starts from the tip of the coccyx tip, runs from back to the gums of the first upper incisors in mouth. Number of points are 33 points. So there are 6 points newly discovered by Dr. Voll. 27 there is. Now specification, there are 6 new points. In that you can see almost all the points is the GV19A, posterior lobe of the cerebellum, GV19B, the highest point of the vertex, the other cerebellum, here, the back side. Then GV23-1, CMP of the cerebrum. Then GV23-1-1A, CMP, organ degeneration of entire body. You can see here, these are very important. Anywhere there is a degeneration, after 40, there is a degenerative changes happen in any organ or in anybody. So most probably on the cervical spine, lumbar spine, or the inside the eyes, like degenerative changes of the muscles of the eyes inside. So vision disturbances will be there, hearing disturbances will be there, less energy. So degenerative changes in entire body. This is CMP, GV23-1A. Then GV23-2. This is the CMP for limbic system. You know, this is only one meridian where three CMPs are there in governing vessel. CMP for cerebrum, CMP of all organ degeneration in the entire body, and CMP for limbic system, or the limbs, or the movements, limbic system. We know this limbic system is related to nervous system. 23-2. Then GV23A, volts of nasal cavity, all the volts of nasal cavity. Now these points are redefined. GV13 is spinal cord SMP, then SMP for cervical cord of the sympathetic nerve, then lamina tacti, that is thympopsyche, psychic center, emotional disturbance, psychic center, thympopsyche. It is GV17, then GV19, anterior lobe of the cerebellum, then GV21 is the corpus amygdaloidum of the limbic system, and GV22 is the gyrus cinguli of the limbic system. These are the different parts, the names of the parts of the brain, that systems of the brain. Then GV23 is hippocampus, GV25 is SMP for central portion of the upper jaw, the back side, inside, where we touches the tongue, tip of the tongue, upside. Now, 3 control measurement point we have seen this. With the help of these 3 points, it has become possible to treat brain, mental diseases, and degenerations of the body. You can see it is having miraculous results, and even in such kind of patients, brain disorders, emotional disorders, mental disorders, and degenerative changes in the body. So this is very fantastic meridian GV. Along with UB meridian, we can use these points. And CV. These are very in today's syllabus, kidney, urinary bladder, CV and GV. All the 4 meridians are very important in treating so many disorders, difficult disorders. Then 3 summation measurement point. We have seen this spinal cord. Then okay, in the last lines, in governing vessel points related to various parts of brain are explained. It has made it possible to treat various diseases of the brain. More than this, treatment of degeneration of organs of the body can be done on this meridian. It's very important. Okay, we will see one by one functions of this point. You can see the diagram on 229 page number. GV1 is a tip of the coccyx. Yeah, in my area, this light has gone. Okay. Am I audible? Okay. It's electricity problem actually happened here. So GV1 point is the coccyx, tip of the coccyx below. Then GV2, and we know from L5, it is GV3, 4, 5, 6, 7 up to GV14 is on the whole spine backside. Okay. We will see the functions one by one. GV13 is the SMP of the spinal cord. Whole spinal cord's SMP. GV13. This point is the at cervical vertebra number 7. Yeah, you can see in the diagram also. GV13. It is almost near. Actually, in diagram C7 tell GV14, but it's near to GV13. So SMP very near to CV, this cervical 7 vertebra. Okay. Point is that the cervical vertebra number 7. It should be 8 actually, or T1. Okay. Maybe it's a printing mistake. GV16, SMP cervical part of sympathetic nerve. TW1 is also SMP for cervical part of sympathetic nerve. Yes, we know that. GV16. Then GV17, MP quadrigeminal body, upper part of the midbrain, known as a quadrigeminal body. Corpora quadrigemina, optic lobe of brain, this side. Then lamina tecti and thympopsyche. Thympopsyche. Thympopsyche is the emotional constituent of our psyche. It is situated in the upper part of the central midbrain. It is central point for the treatment of mental disorders. See this: depression, melancholy, anxiety. This type of mental disorders can be solved with the help of this point, GV17. In the special note, he has mentioned the lamina tecti houses the thympopsyche. Lamina tecti is a part of the brain. In case of depression, there will be lymphatic swelling between GV16 and GV17. See, GV16 is almost the base of the brain here, and GV17 is just one kun above that. So in between that, there, if you will feel the, you will palpate, yeah, it's hyperactive brain, hyperactive mind. In depression, some patients are hyperactive. In depression, some patients are, if it is anxiety, the patient is restless physically as well as mentally. Restlessness is there, then that's a hyperactive. We have to sedate the point. Mental disorder patient, we have to sedate the point, because the sedation is more required in such patients. In the mental disorders means what? Emotional disturbances. These are because of the excessive thought in the mind, or fear, depression, anxiety. These are because of excessive thought in the mind. Maybe this may happen in my life. This might have happened. This may have happened. It will be like that. If it is like this, then it will be like that. These are the just illusion, delusions, hallucinations, fear, anxiety. This is hyperactive mind. So, in one stage, there is a mental restlessness and physical restlessness in some cases as well. So, this is a hyper condition, excess condition. We have to sedate these points. We have to always sedate in all the cases of depression. Even you can see if this type of patients, if they will go to the some allopathic doctor, psychiatrist. So psychiatric doctor, what they are prescribing? All the antidepressant drugs. Means which are they? These are like sleeping pills. Sleeping pills. They just have to sedate. They just have to sedate their brain, mental system, mind and anxiety, so that patient will be in the sleep or always in the dizziness. So that is the bad effects of those drugs. That is a different part. But we can use these points and we can sedate these points so that patient's mental condition will be flourished. We can cure the patient mental condition. But in case of allopathic drugs, they are just depressing. They are the suppressant drugs, mental suppressant drugs or mental depressant drugs. They are the depressing the function, suppressing the functions of the brain, so that those patients cannot not able to think also in due course. If they will start the treatment after 15 days or 1 month, they will not be able to think about something because they are completely in a dizziness under the influence of those allopathic drugs. So these are very wonderful points. Then the next point is the lamin. Yeah, I was telling about the if in such patients of depression or anxiety, if you will just palpate this area, backside of the head, base of the brain, means GB 16 and 17, that portion. So they will feel little pain there. That's why it is given. In case of depression, there will be lymphatic swelling between GB 16 and GB 17 in one or both the sides. Here, on both the sides, here, on both sides or center. The lamina tecti has 4 small elevations on the dorsal side of midbrain. Where are they? Lamina tecti inside the brain. It has a small elevation, 4 small elevations on the dorsal side of the midbrain. Colliculi superiors, that is rosters. This is attached to the visual pathway upside, and colliculi inferiors, that is cavities. These are attached to the auditory pathway. So audio visual. So there are 2 and 2, upper side and inferior side. 4 small areas. Lamina tecti houses thympopsyche. The thympopsyche is all the control is in the hand of lamina tecti, which is responsible for the emotional feeling part of the inner life, emotional feelings of our daily life. Then depression or melancholy can be diagnosed here in this area for both the sides on the central area, in between GB 16 and GB 17. You see in the diagram also on page number 231, 16 and 17. In between that area is related to audio visual pathways, audio visual. A protocol for the treatment of depression is given separately in the next book, that is treatise 5. Dr. Kemka sir has given the protocols for depression and all this mental disorder. Now come to the next point, GB 19, anterior lobe of cerebellum. If eyeball starts moving like pendulum to and fro, then treat cerebellum. Eyeballs, that is like a pendulum in some situations like thyroidoxicosis or hyperthyroidism. Sometimes this eyeballs comes out like this, and again as soon as patient closes his eyes, it goes deeper, again comes out like this. So in such condition we have to treat this also, GB19. Okay, come to the next point, GB19A. 19A is posterior lobe of the cerebellum. When turning of neck to one side results in the dropping of shoulder on the other side, like this or like this, dropping of the shoulder on the back side, opposite side. If I am turning on the right, left shoulder will go down like this. So this is very important point. And foot comes forward on the same side or dropped shoulder, then it shows that cerebellum is affected of that side, and treat affected side of cerebellum. So GB19A is very important point again. GB19B, you can see in the diagram, GB19A, 19B. 20 is the uppermost point, GB20. So 19B is archicerebellum, the highest point of the vertex, it is called as GB19B. When hand trembles while taking hand to nose like this, and it stops after touching to the nose, then treat the cerebellum. So that means there is a shivering, like there is a trembling in the hands while using the hand for some activity. There is a trembling, so it indicates the cerebral defects. So use this point, GB19B. Even there are some tests mentioned. Ask the patient to walk on the drawn line, and if patient walks on that line like drunkard on the drawn line, one line, then treat cerebellum. Whichever side is the cerebellum, that side's foot starts deviating from line. Correct. Now GB21, corpus amygdala of the listening. Now limbic system, what it controls? All these things: joint, sorrow, fear, flight mechanism, friendship, then liking and disliking, then somatic and autonomic body alteration. See, different things have given for diagnosis, and irritation on this point causes flight defense. In the problem of this part of brain, patient either fights with irritation or starts fighting for his defense, self-defense. Treat this point for the both types of the behavior of fight or flight. So this you have learned in fight or flight mechanism. You have learned while learning nervous system in the BHB, fight mechanism. It's a part of a corpus amygdalum area of the limbic system, which controls this emotional behavior patterns. Okay, then in animals also they have seen this roaring, showing teeth, biting. Because of this following symptom, these symptoms are present in this patient type of patients: roaring, showing teeth, biting, breaking objects, diminished recollection of the recent events, irresistible sexual action, paroxysmal sexual sensation, and perversion, sexual perversions. There is a full topic on sexual perversions, different. There is a sodomy, then urolagnia, different types of there. Increased irritability to environmental influences. It is a special subject that is called as the forensic medicine, FMT, forensic medicine test. So FMT is a special subject which these types of perversions are mentioned. Increased irritability to environmental influences, then outbreak of rage released by unspecific irritations, and increase in fight and flight reactions. So some protocols in such patients is also mentioned in the treatise 5, in the next treatise. Now come to the next point, GB22, gyrus singuli of the limbic system. It is also the part of the brain. It controls food habits necessary for the survival of the individuals. Food habits. If somebody is taking his breakfast, lunch, dinner on the time, he's waking on the time, he's waking on the sleeping on the time, it is disturbed. If he is not taking his meals on the time, he is not waking on the time, he is not sleeping on the time, all his day routine is disturbed. Then this point, GB23. MP2, and let's come to the next page. Okay. Almost on my side actually, this electricity has almost gone. Wait a minute. Yeah. Okay, hippocampus of the limbic system. Function of hippocampus are mentioned on 235 number page. Hippocampus controls the recent memory. Yeah, we know. Controls the action of the mating in the sexual activity. It controls sex behavior necessary for survival species. Damaged hippocampus causes this very bad memory of the recent events. He can memorize the events, but recent memory loss. So many patients are nowadays. Disintegration of sexual behavior. Patient experience excessive or less sexual feeling. Starts wrong means of sex and starts behaving unhuman. There sometimes. GB23-1 CMP syndrome. This is a brain. These there are two parts of the cerebrum: left cerebral hemisphere, right cerebral hemisphere. Every cerebral hemisphere has two parts: brainstem and limbic system. Now GB23-1A. This is this glabella portion on this 23-1A, 23-2, and 23-1, all and 23. All points are here. This is CMP for organ degeneration of entire body. It's very important point. 23-1A. It is here exactly on the glabella where bindi is fixed in the ladies. Treat cyclops here. In this, people stagnates at one place. In this, paralysis of ciliary muscles happens. Okay, stagnation of the pupils happen in such patients. Also treat GB8 along with that. GB8 is 1.5 cone above the apex of the ear. Pupils in center of the degeneration process of the mid-ear, because it is also for the degenerative processes. Then GB23-2 CMP for limbic system. We have seen all these things. Limbic system is governing organ or hypothalamus, endocrine system, and nervous regulatory system. Limbic system composed of hippocampus, cingulus gyri, this gyrus cinguli, and almond nucleus of the corpus amygdalium. So these are the different points. In that, the spatial note is given. You can read this out. So this is bitten by rabbit dog, treat here. Then treat fear and grief. In fear, heart rate increases, arteries shrink, mouth becomes dry, starts sweating, pupil dilates. In grief, ears starts coming, nose starts running, skin becomes yellow, joint and muscles reduce the functionality. Then for the reduced sleeping capacity, treat this point. Then if patient is not sleeping on time, not getting up on the time, not eating on the time, then correct his biological clock, treat this point. It's very specific, GB23-2. This is of the attraction and distraction between opposite sexes, treat this point. Now GB23A, vault of the nasal cavity here, lamina cerebrosa and ethmoid bone. All the sinuses can be treated. GB23 and GB25. This is SMP, central portion of the upper jaw, and it is for the upper odontons. 1, 2, 3, 4. All the 3 points on both the sides. Cavernous sinus and nasal sinus. These can be treated with the. Now we will see some 5 points are there in chapter number 7. Secondary vessel point is called as secondary vessel point, SVP. So their location is given. This point is located on the secondary vessel path between LI20. We know the position of LI20 and UB1 here. In between that is LY30. Treat LY30 with this spinal sinuses. So SVP, you can see in the diagram on page number 239, SVP1. It is located just here in between the pathway from LI20 and UB1. SVP2, MP nasal septum. This point is located on the secondary vessel path between LI19 and GB25. GB25 is here and LI19 in that pathway. So you can see here SVP2. SVP2 on this side. Now SVP3 for cavernous sinus. This point is located on the secondary vessel path between GB23A and UB1 here only. SVP3 you can see just near to this. Then SVP4, MP4 Tyrigo-palatine ganglion. This is a point located between GB25 and SI19 again. This is secondary vessel point. Then SVP5, it is not mentioned in the diagram actually. SVP5 is the sternoclavicular articulation. Here we have seen that previously. This point is located between K27 and UB21. These points are right on both the sides. You can treat for their actions because this measurement point of things, sphenoid and nasal sinus, cavernous sinus, ganglion, Tyrigo-palatine ganglion, and articulation. So this ends you all the syllabus. We'll see. Semester 3. Okay, semester 3. This is semester 3. Yeah? Which are the questions here? Okay. I think this book you want to know about this assignments. What is the page number of assignments here? Can anybody tell me? Is it page number 73? This is long answer questions. You want this only? 73, 74, 75. Page number 9. Page number 9. Assignment paper, okay. No, I don't know this assignment paper. Page number 9 is the Ayurvedic acupressure. Okay, what are the questions? We will cover those in the Wednesday section. 1, 4, 10, and 15. 10. No, I think this is. I am opening this. This is not the book. It's an assignment. Okay, we will see that later. You can ask me in the group. Any question is there? I will put the answers. No problem. I can give all the answer sheet to you. No problem. You just have to study this first. Then we will solve. Okay. Okay. I don't know its function actually, how it is functioning. Participant should be unmuted. Okay, this is almost 5 o'clock. Your Sushma Oza ma'am has come, so she will take the next lecture. Thank you very much, all of you. We will conclude today.
5 minutes break.